My practice is located in Plantation, Florida, and I concentrate on general neurosurgery in particular, but specifically on disorders of the spine and brain. And my typical patient is a patient with a herniated disc or slipped bones that experience a lot of pain. As a surgeon, as a specifically surgeon for the spine, my general approach is conservative. I would like to avoid performing surgery if possible for patients, and only perform surgery when there is no other choice. I never rush between patients. I always spend as much time with the patient as needed for that patient to understand the root of their disease and the way we're going to approach treatment of the disease. One of the patient stories from my own practice that stand out to me is this young lady who came to see me several years ago, and she was in her early 20s and she was morbidly obese and kind of became obese over several years in the prime of her life. And she was newly diagnosed with something called Cushing's disease, which results from a pituitary tumor that secretes abnormal hormones and causes people to become morbidly obese. And I removed her tumor, and I recently saw her 2-3 years after the surgery, and she was a beautiful, normal weight young lady, and that was very rewarding for me to see that. I think what's unique about my practice is that I've been trained by the best neurosurgeons in the field at Columbia University in New York City and Emory University in Atlanta, Georgia, and combined with 12 years of my own experience in the field. I am Alexander Poisik, and I practice neurosurgery with Broward Neurosurgeons.